Dr. Jacob Kneeman here, board-certified pain medicine physician. And in today's video, I'm going to reveal how a healthy eating habit is actually secretly causing more inflammation and arthritis flare-ups. This food could be the hidden reason why your arthritis flare-ups seem to come out of nowhere, why your morning stiffness lasts for hours, and why your joint pain gets worse even when you think you're doing everything right. By the end of this video, you will know the truth so that you can make changes today that will help your pain. Go ahead and hit the like button below and stick around for the entire video because I've seen patients reduce their arthritis pain by 70% in just 3 weeks by eliminating this one food group. The food I'm talking about is grains, specifically modern processed grains and gluten-containing grains like wheat, oats, barley, and rye. You might be feeling overwhelmed right now, or maybe even frustrated because this is yet another thing to worry about. I get it. Managing chronic pain is exhausting, and the last thing you need is someone telling you to eliminate more foods from your diet. But before you click away thinking this is just another anti-gluten trend, let me tell you why this is different and why it might be the missing piece you've been looking for. Modern grains contain 3 specific compounds that act like inflammatory grenades in your joints: gluten, lectins, and amylopectin A. These compounds trigger your immune system to attack your own joint tissue, creating a cycle of inflammation that can last for days after just one bowl of healthy oatmeal. Here's the part that's going to blow your mind. Modern wheat contains 40 times more inflammatory compounds than the wheat your grandparents used to eat. Through decades of genetic modification, we've essentially created inflammatory time bombs disguised as health food. And here's what's really important. You don't need to have celiac disease for this to destroy your joints. There's something called non-celiac gluten sensitivity that affects actually up to 13% of the population, and it can absolutely trigger severe arthritis flare-ups. A 2016 study published in the journal Nutritionists found that people with rheumatoid arthritis who eliminated grains for just 1 year saw their inflammatory lab markers drop by up to 60%. Their joint pain decreased so dramatically that some were able to reduce their medications altogether. Let me give you some context about why this matters so much to you specifically. We're talking about 32 million adults in the United States dealing with osteoarthritis and another 1.3 million with rheumatoid arthritis. That's a massive number of people living with joint pain, stiffness, and inflammation every single day, which means that either you personally are experiencing this yourself or you know someone close to you who is. If you're watching this video, you've probably been down this road before. You've tried the medications, the physical therapy, possibly even injections like the ones I perform in my own practice. You've probably felt dismissed by doctors before who don't seem to really understand how much pain you're really in. I want you to know that I believe you. Your pain is real and it's not in your head. And while the treatments I mentioned above can definitely help in certain situations, so many of my patients tell me the same thing during their visits. Dr. Kneeman, I'm doing everything right. I'm eating what I'm supposed to eat, I think. I'm taking my medications exactly as prescribed. But I still get these terrible flare-ups, and I can't figure out what's triggering them. You know, early in my career, I used to think this was just the nature of arthritis. Unpredictable flares were just something patients had to live with. I was focused on managing symptoms rather than looking for root causes. But then I started taking more time to listen to my patients' frustrations, fears, and daily struggles. I started paying closer attention to what they were actually eating. And that's when I noticed patterns that could actually be changed for the better. Let me tell you about Margaret. She's a 67-year-old patient who came to see me about 2 years ago with severe rheumatoid arthritis. Her morning stiffness was so bad that she couldn't even open jars. She couldn't tie her shoes without the help from her husband. She was starting to feel like a real burden on her family, which was of course breaking her heart and mine. We tried everything in my toolkit: medications, injections, physical therapy. She got some relief, but those unpredictable flare-ups kept coming back every few weeks. She was getting frustrated with me, and honestly, I was getting frustrated too, because I felt like I was feeling her. Then one day, she came in looking absolutely defeated. She had been keeping a food diary and started seeing a pattern, but it didn't make sense to her. She had noticed that her worst flare-ups seemed to happen after days when she was being extra careful about eating healthy, like after days eating whole grains cereals for breakfast, whole wheat sandwiches for lunch, and brown rice with dinner. All the foods she'd been told were good for inflammation. That's when it clicked for me. We decided to try something that went against everything I learned in medical school. We eliminated grains from her diet for 30 days. Zero. Absolutely none. I was honest with her. I really wasn't sure it would work. But we had tried everything else, so I didn't know what else to do. Within 3 weeks, her flare-ups decreased by 70%. Within 2 months, she was back to gardening, which she hadn't been able to do in over a year. Her rheumatologist couldn't actually believe the improvement, and they called me personally to ask what specifically I had done with her. He asked what medication had I started now. When I told him we just eliminated grains, he was a little skeptical, but either way, Margaret had her life back. So let me explain exactly why grains can be so inflammatory in a simple way. Gluten is a protein that you'll find in wheat, barley, and rye. When people with sensitivity consume gluten, the immune system mistakes it for a foreign invader and launches an inflammatory response that can last for days. But here's what most doctors don't tell you, and what I wish I had learned in my earlier career. This inflammatory response doesn't just happen in your gut, it affects your entire body, including your joints. Another study in the journal Nutritional Biochemistry showed that gluten increases intestinal leakage, what we call leaky gut, which allows inflammatory compounds to flood into your bloodstream and into your joints. But gluten isn't the only culprit. Proteins called lectins are also found in grains, and these bind to the intestine and trigger huge immune responses as well. And then finally, there's amylopectin a type of starch in modern wheat that spikes your blood sugar faster than table sugar. These blood sugar spikes trigger the release of inflammatory compounds that then go straight into your joints. Today's modern wheat has been so genetically modified that it contains compounds that didn't even exist 100 years ago. We're essentially eating a completely different food than our ancestors, but calling it by the same name. What is with that? Let me share some more patient stories to show you what's possible. I had a patient named Robert, 58 years old, who came to see me with severe osteoarthritis in both knees. He was doing everything he thought was right. Steel-cut oats for breakfast, whole grain sandwiches for lunch, quinoa and brown rice for dinner. He was actually proud of how healthy he was eating, but he was also exhausted from the constant pain and emotional toll it was taking on him. His inflammatory markers were off the charts. I suggested we try eliminating grains for 8 weeks. His knee pain actually went down from an average of 8 out of 10 down to a 3 out of 10. He went from needing a cane to walk to walking 2 miles a day unassisted. Then there's Linda, 62 years old, with psoriatic arthritis. She came to me feeling completely defeated. She was having severe flare-ups every few weeks despite being on expensive prescription medications. During one of our visits, we went through her typical day of eating, and I noticed she was having heart-healthy whole grain cereal every morning and whole wheat pasta about 3 times a week. Within 1 month of eliminating grains, her flare-ups went from every 2 to 3 weeks to around once every 3 months. Her rheumatologist was so amazed that he started asking his other patients about their grain consumption. And here's one that really opened my eyes. I had a patient named James, 71, with rheumatoid arthritis. His morning stiffness was lasting 3 to 4 hours every day, which was destroying his quality of life. He felt like he was losing his independence, and it was actually affecting his relationship with his wife. He was eating quinoa regularly because he'd read that it was a healthy grain alternative. I actually ate quinoa all the time until I learned that it also contains inflammatory compounds that can be just as damaging as gluten. After we switched him to a truly grain-free alternative, his morning stiffness decreased from 3 to 4 hours down to just 20 to 30 minutes. A 2019 systematic review in Frontiers in Nutrition analyzed 15 different studies on grain elimination and inflammatory conditions. The results showed significant improvements in inflammatory markers and symptom severity across multiple types of arthritis. If all the information I presented resonates with you, consider talking to your doctor about the relationship between grains and arthritis symptoms. While dietary changes are usually safe for most people, it's always best to work with your healthcare provider, especially if you're on medications. If your doctor can't, that's okay. Consider asking for a referral to a dietitian. If this video opened your eyes to a potential connection between grains and arthritis inflammation, please hit that like button below. My goal is to share evidence-based strategies that challenge conventional wisdom to help people reclaim their lives from chronic pain. If you or a loved one is struggling with arthritis and eating grains every day thinking they're being healthy, please share this video with them. This information could change their life. Remember, you don't have to accept chronic pain as your new normal. You deserve to have pain taken seriously, and you deserve to explore every safe option that might help. Sometimes the solution isn't adding more treatments. It's removing the hidden cause that's been sabotaging your healing all along. Thanks for watching, and I'll see you in the next video where we'll talk about the 3 morning habits that can either trigger or prevent arthritis flare ups for the rest of your day. See you then.